Hi there, my name is Rachel Stirk, and I'm the Deputy Director and Senior Scientist at the Center for Global Health Studies at the Fogarty International Center at the U.S. National Institutes of Health. I'm going to be talking to you today about stakeholder engagement and community-based participatory approaches in implementation science. And while it would be much more fun to be in person, this is the best we can do during this global pandemic. I'm gonna turn my camera off to preserve some wobbly Wi-Fi while I give this lecture, but just wanted to say hello before doing so. So we all know that there is a decrepit and long bridge between proven interventions and their successful uptake in the real world. And the implementation science approaches can help make this bridge stronger. And I'm going to be focusing on how stakeholder engagement plays a role in implementation science and really strengthening its impact. But first, as we are all sitting here on Zoom, I should note my most important stakeholders these days are these two small people. But methods to most effectively engage them would take us way off topic. So back to the topic at hand. Overall, and sort of to give some context to the lecture, it really is increasingly understood that support of implementation research alone will have limited impact unless it's accompanied by efforts to facilitate utilization of scientific evidence by health program implementers and policymakers. Knowledge translation and optimal uptake of evidence-based interventions requires deliberate and strategic efforts to facilitate collaboration, communication, and relationship building between the scientific community and implementers and decision makers. Therefore, it's really critical to explore stakeholder engagement strategies that catalyze effective interactions between these stakeholder groups in an effort to maximize public health outcomes and also the return on research investments. Indeed, enhanced communication and collaboration between these communities can help to facilitate better translation of evidence into health policies and programs while simultaneously helping to ensure the research is country-driven and responsive to the local context. Dr. James Lavery notes that science is a social enterprise. Indeed, many scientists and scientific programs interact with a wide range of communities and stakeholders to secure various types of access and permission, to seek cooperation and collaboration for scientific studies, to fulfill regulatory and ethical requirements, and to try to shape research strategies and to improve translation of their findings into policy and practice. There is an increasing recognition that substantive community and stakeholder engagement can improve the performance, even make or break the success of some science by providing the means of navigating and responding to the complex context in which the science is being conducted. However, he notes that the interactions are often motivated disproportionately by the interests and goals of the scientific research, and less by the need to elicit and understand their implications for stakeholders. And as I just mentioned, there is increasing recognition that this engagement of community and stakeholders can improve research, really by providing means of navigating complex social, economic, cultural, and political settings in which the research is being conducted. However, he also notes that for community and strategic engagement to become more widely accepted and utilized in research, we need a convincing body of evidence about the nature of these strategies and their specific contributions to the performance of research. Melody Goodman notes, with the uptake of implementation science, the scientific community is shifting the focus from pure discovery to include the translation and implementation of new scientific evidence into real-world settings. Indeed, she says, there is evidence to suggest that stakeholder engagement is key to both implementation and translational sciences, which includes tailoring best practices for specific population contexts. Understanding and engaging stakeholders in the health system research has been recognized as important for aligning research and policy agendas, for increasing buy-in for the implementation and scale-up of evidence-based interventions, as well as for facilitating evidence-informed decision-making. Research can find important stakeholders to engage across all levels of a health system, from policymakers and healthcare professionals to community members. Much has been written about the community-based participatory research and action research, and there's also a burgeoning literature on knowledge translation and how to best to engage policy and decision makers in the research process. However, it is much less common for perspectives of such stakeholders, including policymakers and mid-level managers and health workers, to be directly represented in the literature. So moving ahead, which research gets used and why? So we all have probably seen this, the publication pathway, where it takes nearly 17 years to turn 14% of original research to the benefit of patient care. And this is far too long. There was a recent study in 2016 This study looked systematically at which research gets used and why. It noted that while health research is considered essential for improving health worldwide, it remains unclear how it is best organized to contribute to health overall. And the study examined research that was part of a Ghanaian-Dutch research program that aimed to increase the likelihood that results would be used by funding research that focused on national research priorities and was led by local researchers. The aim of the study was really to map the contribution of this research to action and examine what features of the research and translation process were associated with the use of the results. So they used a contribution mapping. They systematically examined how 30 studies evolved and how the results were used to contribute to action. The results of 20 of the 30 studies were used to contribute to action within 12 months. The priority setting and proposal selection process led to the funding of studies which were from the outset closely aligned with the health sector priorities. Research was most likely to be used when it was initiated and conducted by people who were in a position to use the results in their own work. The results of 17 out of 18 of these user-initiated studies were translated into action. Other features of the research that appeared to contribute to its use were involving potential users in formulating proposals and developing recommendations. And really, ultimately, what the study underlined was the importance of supporting research that meets locally expressed needs and that is led by people embedded in the context in which results can be used. Supporting the involvement of the health sector professionals in the design, conduct, and interpretation of research appears to be an especially worthwhile investment. And hereby, another paper supporting the idea that stakeholder engagement leads to more effective research, and certainly in the context of implementation science. So this is a really important supplement published in BMC Health Research Policy and Systems, looking at engaging stakeholders in implementation research, tools, approaches, and lessons learned from the application. Implementation research and the engagement of stakeholders in such research have become increasingly prominent in finding ways to design, conduct, and expand and sustain effective and equitable health policies, programs, and related interventions. The articles in the supplement here that I'm referencing examine some of the tools and approaches used to facilitate stakeholder engagement in implementation research and describe the learning from the experience of the Future Health Systems Research Program Consortium, which over the past decade comprised teams from Afghanistan, Bangladesh, China, India, and Uganda, and worked closely with people and organizations leading the transformation of health systems in each of those countries. And the articles outlined in this supplement pursued approaches that allow key actors to learn by doing. In doing so, they find how implementation research can be usefully employed by providers, beneficiaries, officials and key local actors to improve the delivery of health services, particularly for poor and marginalized populations. And I would encourage you to take a look at this supplement, and it includes some interesting examples. So sort of shifting gears a little bit, what is a stakeholder in research? A stakeholder is any person, group, or organization with a particular interest in research, policy, or program, right? So government agencies, beneficiaries, policymakers, funding agencies, providers, implementers, civil society, researchers, and M&E specialists. The importance of knowing stakeholders is that they view activities from different perspectives. They have different degrees of understanding. They need and want different information. They need information at different levels of complexity and have different intensities of interest. And they also have different roles in the decision-making process. So why engage stakeholders in research? We've gone over this, but it really helps to increase buy-in for implementation and scale-up of evidence-based interventions. It helps to align the research and policy agendas. It facilitates evidence-informed decision-making, transparency, and respect. Stakeholder engagement can play important roles across intersecting research policy and management processes. By selecting and defining the most relevant research questions to address policy and management concerns, to designing and conducting research, to learning from and applying evidence, to making change to policy and programs, and to holding each other accountable. Important results of involving stakeholders in research and the data use process include the relevance of the data, ownership of the data, appropriate and effective dissemination of research results, and ensuring more effective uptake of data in policy and program. Some questions to consider that Goodman actually outlined is, who will benefit from this work? Which are the appropriate stakeholders to engage to address a problem? What processes should be developed and used for partnership, sustainability, and progress along the stakeholder engagement continuum? And how will you evaluate the quality and quantity of stakeholder engagement? And she outlines these key questions to consider when implementing and evaluating stakeholder engagement. So Boaz puts forth design principles for stakeholder engagement. This paper provides a short conceptualization of stakeholder engagement followed by design principles that they put forward based on a combination of existing literature and new empirical insights from recently completed research on stakeholder engagement. The design principles for stakeholder engagement are organized into 3 groups, namely organization, values, and practices. The organizational principles are to clarify the objective of the stakeholder engagement, embed stakeholder engagement in a framework or model of research use, identify the necessary resources for stakeholder engagement, and put in place plans for organizing, learning, and rewarding of effective stakeholder engagement, and to recognize that some stakeholders have the potential to play a key role. The principles relating to the values are to foster shared commitment to the values and objective of stakeholder engagement in the project team, share understanding that stakeholder engagement is often about more than individuals, encourage individual stakeholders and their organizations to value engagement, recognize potential tensions between productivity and inclusion, and to generate a shared commitment to sustained and continuous stakeholder engagement. Finally, in terms of practices, the principles suggest that it's important to plan stakeholder engagement activity as part of the research program of work, build flexibility within the research process to accommodate engagement and the outcomes of engagement, to consider how input from stakeholders can be gathered systematically to meet objectives, and to consider how input from stakeholders can be allocated, analyzed, and used. And finally, to recognize that identification and involvement of stakeholders is an iterative and ongoing process. One thing to note here is that stakeholder engagement isn't often incentivized by research funders, and it's important that this be part of the dialogue and that they increasingly do so, especially in the context of implementation science. Ultimately, the thought is that these principles could be used in planning stakeholder engagement within the context of research and in monitoring and evaluation. A next step would be to address the remaining gaps in stakeholder engagement concerned with how to assess the impact and the contribution of stakeholder engagement approaches. So here, furthermore, Goodman outlines stakeholder engagement classifications, and these are really to think about how the stakeholder engagement is being done. And these classifications range from outreach to education to coordination to cooperation to collaboration to patient-centered, and then finally to community-based participatory research. Shifting gears again slightly is to think about tools to analyze stakeholder engagement. And I'm just going to highlight that there's a stakeholder analysis matrix and engagement plan, the purpose of which is to ensure that research reflects the needs and values of relevant stakeholders to support data use in decision-making. And the objectives are to identify the stakeholders, define their roles, identify dynamics among stakeholders, and then set up an optimum stakeholder group. So this is just an example of a tool that can be used where you look on the column titles where you're logging the name of the stakeholder organization or group, the description, the potential role in the issue or activity, the level of knowledge, level of commitment, and available resources. And then on the rows, you see the different levels of stakeholders. And this was used, this is just an example of one way to use this matrix. This was being used by USAID to develop a development plan to scale up PMTCT programs throughout a system. And you can see they're looking to convene stakeholders to identify priorities based on available data and develop an action plan. So they have Government National AIDS Control Committee. They describe how they're involved in the issue at hand, the potential role of the activity, the level of knowledge, the level of commitment, and the available resources. Moving beyond stakeholder engagement, there are many models of participatory research, which are utilized when the researcher prioritizes engaging and empowering stakeholders and have the capacity to increase the impact of interventions, and improve health. So all of these models depend on relationships among stakeholders to include researchers, beneficiaries, end users, policymakers, and program implementers. Challenges to using participatory models are well documented. Preparing partners for research engagement is one challenge, the time-consuming nature of building these relationships, ethical considerations, and then reconciling different priorities and interests pose significant challenges. I would add one there also is that funding often doesn't incentivize the time it takes to build these relationships. But nevertheless, several models have been used effectively in health research. I'm highlighting here a toolkit that is is on the Fogarty International Center website and was developed out of a neuroscience learning collaborative around implementation science that really highlights participatory research models in building stakeholder relationships. And it's a very high-level resource, but one that might be of use. The toolkit outlines action research, participatory action research, community-based participatory research. So action research is really a process of inquiry that describes, interprets, and explains social situations while executing a change intervention aimed at improvement and involvement. It's problem-oriented, context-specific, and seeks to influence future action so as it is useful when attempting to resolve a recognized problem in a systematic way. Participatory action research is a research process involving practitioners from the initial concept and design of the project through to drawing conclusions and determining resulting actions. A social research methodology characterized principally by low-ranking individuals in an organization and communities participating in decision-making related to research. And then community-based participatory research is a participatory cooperative process between community members and researchers in the research process. Community-based participatory research is probably the most well-known, and it focuses on bringing together multiple stakeholders, including practitioners, researchers, and communities to, 1, establish trust, 2, to share power, 3, to enhance strengths and resources, and finally, to examine and address needs and health problems with solutions developed in a collaborative process. Contracts to consider in the context of CPPR are, when engaging multi-level stakeholders in the research process, really are the commitment of stakeholders to the process and the goals of the process may vary. Capacity of stakeholders to participate in the process and engage in research activities also might vary. Commitment of researchers to meaningfully engage stakeholders, again, often not incentivized in the research funding structures. And really trust among researchers and stakeholders. And these all take enormous time to build. I'm going to shift gears now to just talk a little bit from a sort of funder level perspective on one way that we are working to sort of build a model that engages stakeholders, from researchers to policymakers to program implementers. And this is a program that this model we're running out of the Center for Global Health Studies at Fogarty. And we're calling them Implementation Science Alliance platforms. And the idea really is to using implementation science to enhance the effective use of evidence and help overcome implementation challenges by really catalyzing collaboration and communication among implementation scientists, program implementers, and policymakers. We're essentially curating platforms or networks to facilitate dialogue and exchange of ideas between researchers, implementers, and decision makers, really in order to enhance communication and collaboration between these communities to enable more effective translation of evidence into health policies and programs, and to ensure that future research is responsive to the local context and that policymakers and program implementers are aware of research evidence in real time. And finally, through these networks, we're able to really comprehensively think together about the emergent implementation science agenda and really the key implementation barriers to the uptake and use of proven interventions in the real world. So we've done this type of model across a range of disease areas, from brain disorders to the adoption and uptake of clean cooking, to the prevention and treatment of mother-to-child transmission of HIV, and then finally to thinking about adolescent HIV prevention and treatment. And one of the things that's emerged that resonates very much in the context of thinking about engaging multiple stakeholders is that researchers and users of research evidence have really different perspectives on what evidence is most useful. They importantly ask really different questions. They are answering to different stakeholder audiences. Defining rigor and sufficient rigor for scalability differs from a policymaker, between a policymaker and a researcher. And really the tension that you see in implementation science, specifically between generalizability and the real importance of local context. So some guiding principles when thinking about stakeholder engagement is that ownership fosters use. So if our goal is the uptake of evidence into policy and practice, this is really critical. Stakeholder engagement improves really the relevance of data at a local level. Stakeholders really should represent a diversity of perspectives, and they do. But if you're engaging them in your research, you should make sure that you're engaging a range that represents a diversity in the population you're studying. It helps us to recognize the differing roles of stakeholder groups and individuals, and engaging stakeholders throughout the project or research project process from design to follow-up is critical. And I think we often, in the research world, we might engage them around dissemination of results, but if they're not bought in the design phase, that dissemination is going to have less traction. And the more stakeholders, the greater the complexities of the project design. But with important support, it can enable translation and uptake of evidence in a much more quick way. So if I could take questions, I would. And again, these are my key stakeholders circling back. And finally, I'd love to thank you, and hopefully we can do this in person sometime.